Healthcare reform, eliminating and replacing Obamacare. Those are the big topics this week in Washington. And the subject moved ahead in a big way this week when a bill that House Republicans have put together that's designed to not so much repeal Obamacare, but replace it with something that builds on Obamacare, throws out some parts, keeps some parts, advanced first of all in the Ways and Means Committee, which dealt with the tax parts of this bill. And then later on Thursday from the Energy and Commerce Committee, the same bill moved forward. That's the committee that's dealing with some of the more healthcare related elements. But I think increasingly the attention is being shifted toward the Senate. It's likely that the Republican leaders in the House, under Speaker Paul Ryan, will figure out a way to get this passed through the House with the comfortable majority Republicans have there. But things are looking very problematic in the Senate. On the conservative side, Tom Cotton and Rand Paul have both said they think that the House bill is not going to work in the Senate. In fact, Rand Paul has said it's dead on arrival. And a moderate Republican, Susan Collins, has said the same thing, but for different reasons. Conservatives in the Senate are unhappy that this doesn't eliminate Obamacare cleanly and efficiently enough. Susan Collins is worried that it'll knock too many people out of health care coverage, particularly by rolling back the Medicaid expansion that was in Obamacare. So you put that together in the Senate, where there's very little margin for error, 52 Republicans needed, 50 votes needed to get it passed there. There's going to be some problems. Here's the footnote to that. Even if this gets worked out in the Senate, it may take some time. The more time spent on health care, the less time that's available this year to deal with the next big issue for Republicans, which is tax reform and tax cuts.